And of course, this extreme cold can be very dangerous. So tonight we want to talk a little bit about frostbite and how to avoid it. So joining me now is Dr. Jason Vieder, a doctor of emergency medicine at Henry Ford Health. Thanks for joining us today, Dr. Vieder.
Hey, it's good to be here.
So you may have heard our meteorologist talking. We have single-digit temperatures right now, wind chills even colder. Is this the kind of weather we really need to be concerned about? Is this frostbite territory?
Yes, absolutely. This is the kind of weather where what we wear is very important, and the amount of time that we're exposed to this cold weather is important. Just for reference, when you're in weather at about 0 degrees, which we certainly are, 30 minutes where you're not properly clothed could result in frostbite. And as we get lower to like -15, that time can be halved. So you could be developing symptoms of frostbite in about 15 minutes.
Wow. So let's talk about those symptoms. What are they?
Yeah, so frostbite has a couple of different sort of flavors. At first, we can get something called frost nip. So frost nip is the start of frostbite. You'd get some skin redness, some numbness. Obviously, you'd start to feel pretty uncomfortable. When that progresses to frostbite, your skin can become white. You can get that pins and needle feeling in your skin. Your skin can actually start to look sort of hard or waxy. And then you start to get other symptoms like feeling clumsy or drowsy. These are very specific symptoms that would make you want to get out of the cold as soon as you can.
So just out of curiosity, Dr. Vieder, what exactly is frostbite? Is it just a skin deep condition or is it a more systemic issue?
So frostbite is generally specific to one part of you, and there are different, as we're saying, there are different degrees of it. You can have more severe frostbite or frost nip, which is less severe. Then, of course, we can talk about hypothermia, and that's more of the systemic problem that you're referring to when your core temperature falls below um, 35 degrees Celsius or 95 degrees. And then once again, you start getting these more systemic symptoms of you can start to feel stiff and clumsy. When it gets more severe, it can lead to heart rhythm problems, breathing problems, and worse.
Are some people more at risk for frostbite than others?
The people we worry about the most are people that are obviously exposed for long periods of time, people that are working outside. Older people are more susceptible to cold related injuries. Folks that have cardiovascular problems or smokers are also more susceptible to getting something like hypothermia or frostbite.
Now, when you're outside, you're right around that risky mark, maybe 30 minutes you mentioned if you're properly clothed. Does it tend to be pretty obvious when you're starting to suffer from frostbite before it's too late, or do you tend to find out about it after it's too late?
Yeah, it's a great question. And sometimes you don't know right away. I think it's really important. I tell people all the time, you have to trust your instinct. And if you start to feel really uncomfortable, you're obviously suffering from the cold weather, it's time to get out. And the most important thing we can do really is to wear the proper clothing. So what that means is generally you want to layer, and there's a minimum of 3 layers. The first layer that's closest to your skin should try and move moisture away from your skin. Any sort of moisture would accelerate how quickly it'll take to have symptoms. That middle layer is more of an insulation layer, and then the outer layer, like your winter coat, should keep the elements away from you. Additionally, wearing a hat is very important. You can lose about 30% of your body heat through your head. So wearing your hat is very important. And the areas that are most susceptible to frostbite are the areas that are the furthest away from our circulatory system. So that's like your fingers, your toes, your ears, and your nose.
So let's say it does happen, you're starting to feel those symptoms, you've been outside too long. What should you immediately do? And is there anything you should avoid doing at that point?
Yeah, it's a great question. Also, the first thing you want to do is get inside, get somewhere warm. You want to take off any clothing that's damp or wet. Then you can also drink some warm drinks. It's a little bit of a misnomer. You know, you probably remember growing up, you'd see a cartoon with a St. Bernard with a barrel of alcohol. You want to avoid alcohol. Alcohol will actually shunt some of the blood away from your core organs, and that's not a good idea. So warm drinks that are non-alcoholic. And you do not want to get into a hot bath or put your hands over, any sort of flame that can cause a burn. You want to do gentle rewarming, so it's just lukewarm temperature water to try and rewarm any part of you that's really cold. If you're having other symptoms that are affecting your whole body, like you're feeling stiff, you're clumsy, you're having trouble with your breathing, that'd be a reason to go report to the emergency department immediately.
Right away. All right, Dr. Jason Vieder from Henry Ford Health, thanks so much for joining us today.
Anytime.